Well, stocks ended mostly higher, boosting markets to their best first half gain in years. I'm going to share you my ideas and strategies for the second half of the year, and I've got some all-stars coming to help as well. But first, to the healthcare scramble. Senate Republicans heading home for the 4th of July recess without a new deal on healthcare, missing their own self-imposed deadline. President Trump now urging senators to repeal and then replace. In a tweet earlier today, if Republican senators are unable to pass what they are working on now, they should immediately repeal and then replace at a later date. Fresh calls for a repeal first underscoring divide within this Republican Party as they head on out. I want to bring in now to discuss Katrina Pearson. Katrina, golly, this listen, obviously, you know, we know that the Republican Party is a party of ideas and a lot of different factions, if you will. This is something of a letdown, though, isn't it?
Well, yes, Charles, and you know, this is where we are today. And although you have many Republicans who feel like, you know, this particular bill isn't the way they want to go, they've made promises, and they've been doing this for the better part of nearly a decade now, and now it's time to deliver.
Well, you know, along the way, the first time they kind of, you know, derailed this or scuttled it earlier in the week, your organization got some of the blame. In other words, putting out the negative ad against one of the holdouts. Do you feel responsible for sort of making this thing worse, you and your organization?
Oh, no, not at all. In fact, that senator is actually back at the table to make a discussion. The only reason why we ran that ad was simply because, unlike the other senators that were opposed to the current bill in its form, because he didn't have any alternatives and simply walked away from the table. This is the opportunity for senators who don't like this bill to come to the table and work with leadership to make it better.
Now, it's one thing because everyone's sort of listen, the entire party was able to rally against this, but it's another thing to cobble it together. We're finding out it's very, very difficult. So someone's going to have to fall on their ideological sword here. How do you think it eventually comes to? Because the conventional wisdom is that something will be done.
Well, yes, and something does have to be done. There's no stopping the collapse of Obamacare, and next year you're going to have counties that don't have a single insurer to choose from. But look, for the better part of a decade, Republicans have been saying we want to repeal and replace. We want to repeal Obamacare. We need to stop the individual mandate. And now they have the opportunity. So I'm really having these complaints fall on deaf ears, considering how on January 20th, when President Trump was sworn into office, there wasn't a single bill that the Republicans had to put forward. So here we are today in the reality that we have, and we didn't get here overnight. We're not going to get out of this overnight.
How much do you blame leadership for that in the House and the Senate?
For ownership, well, I think that they're both houses are owning this issue. You know, in 2015, the House repealed Obamacare, sent it to the Senate. The Senate repealed Obamacare and sent it to President Obama. So we have to deliver now, because there's no way the party is going to be able to go back to their districts not having done something about Obamacare.
Well, they're going to go back to the districts this weekend, and I think they're going to catch some hell, some of it rightfully. Katrina, please stay right there. I want to bring in the panel for additional insight. Joining us now, Tammy Bruce, DeRoy Murdoch, and Michael Barnes. Michael, I want to start with you. It's complicated. We learned that in the House version. They were able to compromise, but here you've got these senators who are in these states where they've taken on so much Medicaid expansion, which is additional big government, and those big government dollars, they are just reluctant to give that up.
Those big government dollars, though, are yielding a great result in terms of the ability of those people to access health care. And politically, we see that there are two new polls that have just come out that show that not just Democrats, but independents and even Trump's core base appreciates the patient protections of the Affordable Care Act, the ability to have coverage for pre-existing conditions and essential health benefits like maternity care and addiction treatment and mental health treatment and prescription drugs.
But you're not suggesting that Obamacare is working, are you?
I think it definitely needs fundamental reforms, and a lot of those reforms are actually in the House and Senate bills. But what they need to do now is compromise with some of the very moderate red state Democrats like Joe Manchin and stop trying to make it work for people like Rand Paul and Ted Cruz, because there's no way that anything is going to pass with their approval that is actually going to satisfy these moderate and mainstream voters that are benefiting and actually have shown in polls are supportive of the protections that are under current law.
Let's talk about that math, guys, because ironically, I think Michael might be on to something if you say, okay, you've got 4 hardcore conservatives on one side, Tammy, 5 hardcore moderates on the other. Maybe it might be easier to assuage these folks and find 3
Three Democrats will do it.
If they exist.
Well, look, this is why now this should have been the original plan, this notion of repealing and then doing the replacement later. That is actually the better idea. They already have the bill for replacement. We know it went to Obama and he vetoed it. That's done. The problem with the replacement is it's turned into a Christmas tree. And so that's where the divisions are. You can get the repeal done with just the Republicans. It'll be maybe 50-51 with Mike Pence. And then you can have the Democrats helping to support what will end up being a little bit of a Christmas tree with the replacement.
There's no way you can get it through Republicans.
I beg your pardon, excuse me. This is one of the arguments about how we can move this, but something has to happen here. And let me just say, when it comes to who you're going to appease, the American people elected Donald Trump because they did not like being lied to by both the Democrats and the Republicans.
He's a negotiator. He can make this happen.
Michael, hold on one second, buddy. Let us finish. We'll come back to you in a moment.
I did not interrupt you. The difference is that I've lost my point, and that was I suppose.
Well, while you regain that, let's bring in DeRoy for a moment, because
sure.
I've got three options for you.
Okay.
Compromise, punt, or surrender. I mean, that's where the Republicans are tonight. Compromise, punt, or surrender.
About a fourth, which is redo. I like the idea of doing a repeal first.
Yeah.
As we've all said, this has been done, and everybody, I think but one senator voted for this, and all but 2 or 3 members of the GOP House a couple of years ago. So bring back the same bill, vote on it again. And secondly, why do we have to have one giant bill? Why can't we have dozens of bills? We can have one bill to start universal HSAs, another bill to let people buy across state lines, another bill to let people have catastrophic coverage, another bill on opioid funding, et cetera. And you may find that Democrats vote for some of the opioid funding. You may find that they support state lines, perhaps, and have a dozen different bills and a dozen different signing ceremonies. We don't have to have one giant bill and then magically try to get 50 or 51 votes behind that bill.
Katrina,
many bills. That's the way to do this.
Katrina, it's obviously easy to point to all the things that are wrong with Obamacare. Almost every single day, there's a new headline about another county or even an entire state without any insurance companies. The answer, though, the ultimate solution that your organization backed, what does that look like?
Well, we back the pro-America policies that come out of this Congress or come out of the White House. And right now, this is what we have. And I agree with Tammy Bruce. You know, one of the things that I think the more moderate establishment Republicans don't realize is that they did not win in November. Donald Trump won in November, and that's a very different scenario. The president did tweet today that he does support something like that Senator Rand Paul was talking about, going ahead and going with the full repeal and then put in the replacement over time. Because the president also understands that we didn't get here overnight, and maybe we have to take this apart piece by piece. But at the end of the day, Republicans have to deliver on this one way or another.
Yeah. Let me just add about
Republicans
the repeal.
elected a negotiator.
Excuse me. We've got to have a handle on this. One of the things that people believe is that on the repeal bill, and there will be some fear-based in this, it doesn't happen overnight. There would be a year to implement. The insurance companies understand and anticipate this. They already know. In a way, Obamacare's already been repealed because it doesn't exist.
Well,
it's failed.
It's crumbling beneath their feet.
Exactly. So you can repeal this. Everyone's going to say, oh, my gosh, what will people do? It will be fine. There will be a year to implement. But in the meantime, you can even have both votes the same day if you wanted to when it came to what you'd replace it with, or it can be done over time, as Katrina and others have mentioned. So this is something that can be easily done. It's not going to destroy people's lives and actually get more people into a frame. People aren't going to be losing their insurance. This simply allows people to be able to choose whether or not they want to have insurance, and we're back to that free market.
But how long people to choose whether or not they have insurance? Insurance means that they choose when they get sick, and you then don't have a system that actually works where insurance is there for people when they need it, and then other people pay into it when they don't need it, so that ultimately you've got a system that is fundamentally strong. That's the problem with where we are now, is that insurance is now at a point where the people who are continuing to participate are those who are only sick and need it. We have to have a strong incentive, if not a mandate, and I'd support the repeal of the mandates, but a strong incentive for people to buy in and then to get insurance protection so that's there for them when they need it.
It sounds like the answer to me, DeRoy, is the free market being involved. The Walmart of healthcare insurance, the Amazon of healthcare insurance. That seems to me the only way you can get policies that will match demand for younger people, inexpensive, older folks. And that's been completely shut out of the equation.
I think there are two ideas. One is if we want to have spending on Medicaid, put it into health savings accounts. Let people who have Medicaid funding put it into health savings accounts and let them shop around for policies they like, number one. Number two, why have state lines? Why not have companies sell health insurance coast to coast? Why not have Geico Care? a big company like that sell insurance coast to coast without having it decided and divvied up by state health insurance commissioners from coast to coast.
All right, guys.
All that's fine as long as people participate when they're healthy.
We got to leave it there. I always tell people, in
Charles.
1954, the first color TV came out. It was $1,000, the same as a brand new Cadillac.
Yep.
Well, you know, you can get a lot of TVs for the inflation-adjusted price these days. The free markets have to play a role in this.
Absolutely.
All right, now forget
That's
about health care reform for at least a minute. How about tax reform? You want to talk about something everyone can agree on? We're going to still debate it next.